Hi, everybody, and welcome to the Pacific Islander Health Board's Facebook Live introducing the COFA Islander Outreach Program. My name is Mia McFarland. I'm the program manager for our outreach program. We're very excited to have everybody on tonight to learn about what PIHB will be doing for our contract with the Healthcare Authority, get a little bit of history on the organizing that it took to get here, and a presentation from the program managers at the Healthcare Authority. So just a quick overview of the agenda here. We'll start out with a presentation from Auntie Jolly, the history of COFA Islander programs in Washington. Then we'll move on to introducing the PIHB team, present on the PIHB programs, make sure we get that presentation from the Washington Healthcare Authority on Washington Apple Health, and then do a Q&A towards the end. So throughout the presentation, if you have any questions that you really want answered, you can put them in the comments and we'll go ahead and answer those. So without further ado, I'm going to stop sharing. And then I'll pass it to Auntie Gigi.
Thank you. Thank you, Mia. And thank you for having me here. Well, as Mia was mentioning that I'm talking a little bit about the history of COFA. I'll try to go and do as much as I can about the history. But I would first of all say that COFA and everything that we've advocated for, it was through Children Alliance. Children Alliance was there from day one. First, it was the food stamp, how they were going to cut COFA people from having food stamp. But we advocated for all of that, and it came back to 100%. And then again, Children Alliance helped us really understanding a little bit about how to advocate, and walked us through it, walked us to the Capitol, and really teaching us, that our voice matter. So as a COFA migrant, I don't really understand how to advocate and all that stuff. So all that was introduced by Children Alliance and all their work into bringing us into speed of what's happening, having classes of taking advocacy work and just doing, little demonstration here and there in classes. It really helped because myself, we are in our culture quiet women. We take what we learn or what we do, and we just do as we can. Advocating was not part of me, but understanding our community's needs, being an interpreter, and hearing what all the health disparities and how the injustice for our people was there. It just, I don't know, it just drove me to try to figure out what to do and how to do it. And Children Alliance was there to educate myself, and a bunch of others, but I'm going to speak on my opinion of things, and it was a really long fight for getting COFA medical, but we finally did it, and it just made us, I think, the community be stronger in how we're fighting justice, the health disparities of our people. I think that just brought all of that, and now we're at the point of trying to advocate for any wrongdoing that's happening to our people. We still got a long ways. Our people is there's a lot of health disparities, and we face all of these challenges and barriers of getting medical. There's been a lot of our people that has passed away from all this, and those are the things that we try to remember, when all these health disparities are happening. I feel bad a lot of times because a lot of our families have passed away and they never got the chance of having health care, and with this, with everything that's going on, I'm also grateful that we got this, like this space here that Pacific Island Health Board has. I'm thankful for that. Um, as a Marshallese, I am, like I said, I am very grateful and I'm also very saddened that everything has happened to our people. But as we are all Pacific Islanders, we try to help each other, and I'm grateful for the space that has opened up, and even space that we can talk to HCA and try to input with everything that is not going well. Hopefully, it'll get better, and us all working together and trying to do that. But like I said, it was a been a long haul, but still, there's some we can make changes in politics and passing the COFA medical and getting our food stamp back to 100%. It just shows you that, together and really talking about our struggles, of the circumstances that we're in, COFA, we're just not here just to, as some comments have made, just here to collect or just here to be spoon fed or something like that. No, we are here as anybody else, and we are here because there's a damaging history to our people. So I hope that we all can remember that, that as we are advocates, as we are people that are working for our communities, that it's the need of our community first, our people, and let it be heard. I didn't practice, so I don't know if I need to go on. I don't know how much time, but I think I'll stop there.
There we go. No, that's great. Thank you so much. And it's really inspiring to hear all the learning that you did to get to, do some pretty amazing work and super impactful work in Washington State. And to have that, still be around today and still affecting people's lives. That's amazing. And we're so grateful, especially, being an organization that is somewhat new to this work and a little bit less new to that advocacy portion. We appreciate all the work that you and all the other organizers had to do to get this all running. It's historical, honestly, which is amazing.
Thank you.
Yeah, and thank you so much for joining us. If you have any questions for Auntie Gigi, please put those in the comments, and we'll make sure to ask her if she can stick around. All right. So the next portion I wanted to move into, technology, is our presentation from the Pacific Islander Health Board. So I would love to introduce formally to the community all the folks who will be working on this project from the Pacific Islander Health Board, starting with Renza.
Thank you, Mia. Hi, everybody. My name is Renza Milo. I'm a Chukis navigator. I work with the BI Health Board, and I'm also working for the COFA. I'm a COFA navigator. Napuranim nga kits menisid itay bansa ngakseri tu ngagwa karangeri ay Pacific Islander Health Board. Wepeki na rin is very insurance, but wepeki tiyak. Kinisotapu.
Thank you. Alinda?
Yawayalet, Eday Nalindalit, Ngalirigin Village in Marshall Islands. Ngay Chuan Community Navigator ng Pacific Island Airport, yung Parainuat COFA Health Navigator, yung Cara Palkichan Pacific Island Health Board. Chalapur. I am Alinda Alik and I am from Marshall Islands. I work as a community navigator and also COFA L navigator. Thank you.
Thank you. Diela?
Hello, can you guys hear me okay?
Yeah, we can now.
Sorry for the delay. I'm on school Wi-Fi. Hello, my name is Diala Ueki. I'm one of the PIHP navigators and I work or to help the Palawan community. Ali, ang kila Diala Ueki, ang katarab SL Healthcare Navigator, lagi din na Pacific Islander Health Board, ang audior, al niya, so other Bella, kira Washington.
Thank you. And then Clara, I put you on mute, but if you can click the unmute button.
Hi, I am Clara, and I am Clara Monfal from Yap Island. I'm a Yapese navigator for COFA Islander, also working for Pacific Islander Board. I'll be here. Ikaw Clara. Ano ba nuab? Ano ba ibaga COFA Islander navigator? Ano ba mrul utan Pacific Islander Board. Thank you.
Thank you. And then my name is Mia McFarland. I'm the program manager. And then in addition, we also have translators from Costa Rica and Ponape that will be available. And we'll talk a little bit more about that. Oh, did we lose Diela? Okay. Well, we'll continue on if Diela gets jumped back on. So as a Pacific Islander Health Board, we seek to cultivate resilience within our communities to achieve health equity through culturally safe and community-driven solutions, traditions, advocacy, and policies. We envision a world where all Pacific Islanders are healthy, connected, and thriving, and we value that health is spiritual, physical, and emotional. We value our traditional healing practices and hold advocacy, community, equity, social justice, and liberations as means to guide our board. So just a quick overview of what our outreach program does. So we provide Washington Apple Health enrollment and COFA Islander programs enrollment assistance to all of our COFA Islanders throughout Washington State, both in person and virtually. In addition, we put on education events about Apple Health and COFA Islander programs. We have a toll-free phone number set up that people can call for assistance, whether it be for enrollment or just if you have quick questions, at 888-308-7113. We provide translation services and interpretation services in the main COFA languages. So Chuukese, Costa Rican, Marshallese, Palauan, Ponapean, and Yapese. We engage community leaders in planning and outreach for programs, making sure to engage leaders throughout the state from all the COFA communities. And finally, we develop a resource guide for COFA Islanders and post it to pihealthboard.org/COFA-Islander-outreach-information. And then I will pass it to Renza. Who's on mute?
Sorry. As we're doing our outreach for the year 2022, BIHP COFA services, we have the toll-free line, educational series on Washington Apple Health, qualified health plans, and COFA Islander programs, certified navigators, in-person and virtual enrollment events, quarterly community-based workshops.
You're back on mute again. Renza. Did your kids come in? Oh.
No, I don't know why I keep going. If you do have a question about your insurance, speak to a navigator today. Apple Health enrollment is open year-round. BIHB will have a phone number to call for question and application help. Call BIHB toll-free line 1-888-308-7113 from 9 a.m. to 6 p.m. Monday to Friday. We offer translate Chuukese, English, Marshallese, Panoan, and Pompeian. Yuppies.
All right. And then Alinda.
And there is also educational event series on Facebook Live, which will happen in February 3rd. On topic, what is Apple Health? And February 17th, it's about you qualify for Apple L and what is next. And March 3rd will be about how to approach problem. I cannot see the words.
And who to contact.
And who to contact. And in March 17th, reviewing coverage. Or yeah. And in March 31st, qualified L plan and COFA Islanders programs.
So that'll be the same every other Thursday at 5 p.m. So the same time as this Facebook Live.
Okay. And there will be monthly Apple enrollment events which will take place in all the counties: King County, Snohomish County, Skagit County, Pierce County, Thurston County, Collins County, Clark County, Panton County, Spokane County. And these are in-person enrollment events which you can go and apply for insurance and get help. And due to the increase of COVID cases, all enrollment will appear virtually until our team can go back in person. An updated calendar will be shared to our social media when we return to in-person services. Thank you. Kumoltada.
All right, Renza, could you take this one, please?
Virtual services. Enroll in Apple Health today. Skates on one-on-one help from COFA Navigator with Apple Health Enrollment on Zoom. Apple Health Enrollment. I will help. I'm sorry. Help will be available year round. Every Monday, 2 p.m. to 6 p.m. Wednesday and Friday. Also, we do the translating.
Yeah. And those appointments can be requested at pihb.org/COFA Health. Or you can call the toll-free line, whichever one is easier. And then as far as events for our community leaders and our community-based organizations, we have a workshop that's going to happen quarterly. Our next one will be April 6th, 2022 from 5 p.m. to 6:30 p.m. on Zoom. And if you would like to join the quarterly workshop, you can either call our toll-free line at 888-308-7113 or email me at mia@pihealthboard.org. If you'd like to view the notes from the previous one, or if you miss a quarterly meeting and you would like to see the notes, those notes will always be posted to pihealthboard.org/COFA-Islander-Outreach-Program. And then if you would like an event in your community and you see that we're coming to your county, or if you see that we're not coming to your county, you can also contact me at my email or at my direct line, which is 206-895-1343. Now I'm going to pass it over to the HCA team to do a presentation on Washington Apple Health. If you have any questions about the presentation that we put on, please post those in the comments and we'll make sure to answer any questions. All right, whenever you're ready to share your slides.
All right, thanks, Mia. I'm going to share my screen. I apologize. It's pretty heavy. Can you see my screen? Which
I
screen?
do.
Oh,
Here we go.
there we go. So half a day. I'm Roz. I am sorry. I'm Roz Leon Guerrero. I am the Medicaid Eligibility Policy Manager and the COFA Islander Program Manager. I'm here with Ariel Pirtek. Ari, do you want to introduce yourself?
Hi, everybody. Ariel Pertek with the Healthcare Authority in Medicaid Eligibility Policy. I've worked with Roz to bring up COFA Islander Healthcare and COFA Islander Dental Care and assist with the transition to Washington Apple Health for COFA Islanders. And really happy to be here to just give a brief overview of Washington Apple Health. We know that the next educational event will be a much more detailed event or education series on what is Apple Health. But we just wanted to let everybody know that Apple Health is a program that you can apply anytime. So we wanted to give some details about that.
Thanks, Ari. Okay, let's see. Okay, Mia, it's not moving anywhere. There we go. So our agenda for today, we'll do a Washington Apple Health overview. Medicaid in Apple Health is Medicaid in Washington State. We'll also talk about Apple Health's next steps, and we'll share some resources. All right. So an overview of Apple Health. Apple Health provides care to over 2 million Washington residents. These include pregnant individuals, children, elderly, and adults ages 19 to 64. Apple Health provides medical, vision, dental, dental benefits, and healthcare services such as preventative care, cancer screenings, treatment for diabetes and high blood pressure, and many other healthcare services. There are no co-payments, deductibles, and other out-of-pocket expenses. Eligibility for Apple Health. An application is required to determine if an individual is eligible for Apple Health. Most individuals eligible for Apple Health apply for coverage online at WAHEALTHPLANFINDER.org. And before I move on, I just want to share that we'll send this to Mia at PIB, and she will post it up on the webpage for resources. But individuals can apply on the WashingtonHealthPlanFinder.org website. COFA Islanders must meet all eligibility criteria for Apple Health, including income limits, Social Security number requirements, and Washington residency. Income verification may be required before eligibility for Apple Health is determined. If proof of income is required, individuals will receive a notice with the request. Classic Apple Health. Classic Apple Health refers to programs administered by the Department of Social and Health Services, DSHS. Individuals who are age 65 years or older, have blindness or a disability, or need long-term services and supports, apply for Apple Health coverage online at washingtonconnection.org, or they can call DSHS or submit a paper application. Eligibility criteria varies for each program and is based on household size, income, and resources. So during the transition from COFA Islander programs into Apple Health, we had sent, this is a copy of a snapshot of a letter that we had sent to individuals who need to renew their COFA Islander healthcare. And November 1st was the start of open enrollment. So this is a copy of it, and it has two information. So if you are to renew your COFA Islander programs, You must renew on the WashingtonHealthPlanFinder.org website or on their mobile application, or you may have been qualified for Apple Health. For those who are over 65, there's information on here that they may be eligible for Apple Health and must apply with the Department of Social and Health Services. And that's our classic, that would be for Classic Apple Health. Applications for Classic Apple Health can be submitted online, WashingtonConnection.org, or by phone. And we'll send this to PIB and they can post it on their website for as resources. Any questions? Are we okay?
I think we're okay for now.
Okay. So you have Apple Health. What are the next steps, right? What are the next steps? Individuals enrolled in Apple Health will receive a Provider One services card. If a COFA Islander had Apple Health in the past, their services card is still valid. They will not receive a new one. So an example for this is if you, before the transition and you were expecting, you were pregnant, and you were enrolled under Apple Health Pregnancy, you had received a Provider One services card. Then after the transition and you had moved into Apple Health, the Provider One services card stays with you. So it's the same Provider One services card. You will not receive a new one. Your Provider One services card is still valid. Correct, Ari?
That's correct. That's not to say that if you accidentally lose it or misplace it, you can't get another one, but it's the exact same number. It turns on and off with your Apple Health eligibility.
Perfect. And then individuals enrolled in Apple Health will enroll in a plan with a managed care organization. And then for more information on managed care, you could visit the HCA Apple Health Managed Care website. Again, we will provide all of these web links for you all. So an example of managed care enrollment or cards. On this slide, we have samples of different managed care programs. Individuals should take their health plan ID card when they go to a doctor, pharmacy, or other health care provider. You can change your plan or plans, but please note that if you have a family, when you change your managed care plan, it will change for the whole family, and it won't take effect till the following month. Right? And then individuals approved for Apple Health are required to report the following changes within 30 days. So that these are change of circumstances, residential mailing address. If you have moved, it's important for you to report that change. Your marital status, your family members or dependents who have moved in or moved out of the residence. If you are pregnant, health insurance coverage, and this could be with your employer, immigration or citizenship status, an income of more than 150 that is expected to last longer than 60 days, or there's a change in your tax filing status. And
the
as
one thing I
always,
would say, sorry, the one thing I just wanted to say with the income is that's $150 for the month. That's not like a weekly amount. That's a monthly total.
Thank you for the clarification, Ari. And as always, we like to share resources. So, and again, these will be provided to PIB and they will share the web links. So Apple Health and COFA resources, eligibility for Apple Health or coverage. If you want to read up on your eligibility, if you are eligible or not, you could visit our webpage. Actually, if you go on hca.wa.gov, you'll find that they have eligibility for Apple Health. You'll also find a first timer's guide to Washington Apple Health. And because COVID is still very present in our community, we have a dedicated webpage. The HCA has a dedicated webpage on resources or information on COVID-19. And then we have the brochure for free and um, um, low cost benefits or coverage. Again, we will share this with PIB. And because we're very resourceful, we like to share the cross-agency desk aid, and these are customer support center referrals. So if you need information on DSHS, this desk aid has all the sections that would assist you with any of the questions you have. If you have questions, you need to contact HCA, like our customer service. We have information on there. Even the COFA Islander programs is listed on this cross-agency desk aid. It's very resourceful and useful. So, Mia, again. And the HCA has a dedicated COFA Islander programs webpage. This is just a snapshot of what is on our webpage. It's the transition to Apple Health. We often talk about it. We talk about it all the time because we want people to know that if you are a COFA Islander, you may be eligible for Apple Health. And we have our email. We still have our dedicated COFA email. That's COFA questions at hca.wa.gov. And we still have our COFA Islander dedicated phone, and that's 1-800-547-3109. And to stay connected and updated, to receive general information or updates on our COFA Islander programs, or even with Apple Health, sign up for our Gov delivery. What we could do is PIB could post it on the web page, and you could sign up through there. And as always, we love when people follow us on social media. We love when you all like the Healthcare Authority, so you could receive the updates and new information that we share every day. We are also on Instagram. Please follow us. And I turn it over to you. Yeah.
Thank you. This the fun of having double computers is having to figure out where everything went. So we'll go ahead and jump back to my PowerPoint. If I can take not forever to share the screen. All right, here we go. So we'll move into questions, and then I've got our contact and resource list to go after. But right now we'll just go through some questions that anybody has. And we'll start, actually, there is a question in the chat that I'm going to need Alinda to translate. So can you see that, Alinda?
Yes, I can see it. Yeah, well,
would you mind translating for us?
Okay. The question is, you want me to say it in Marshallese or English? Oh, English, so you can understand.
Yeah, that would be great. Thank you.
If you are gonna use Washington State Insurance, help me know. Kung pa Apple Health Insurance, right? I think so.
Probably.
One moment. Yeah, I don't really understand, but I think she said, if you're gonna use that Apple Insurance, are we gonna help in renewing? I think that's the question, in renewing that or insurance.
Oh, if they'll need help at renewing insurance?
Yes.
So the answer to that, and please feel free to jump in too, is that you don't necessarily need help from a navigator if you have access to your Washington Health Plan Finder account. However, we are here if you do want help, and we're available on the Zoom sessions or by phone or the many other in-person events at some point?
So, Elmina, ayat ko marong kole dokem, ko marong magayadal ng oram access ak, oram account lo. Wasan na ni el plan find the reo, nga na kaman yung bar kakayale. Ako may marong bar chibang yo. Ilang siwan number ko marong kole dokem mim. 1-888-308-7113. Email nga para ife na wo, kung nilali kami post silo social media. Kamol dada.
Okay, thank you. And then, okay, I'm not sure if this is a question or just a statement.
Okay. I know it. Yeah, where Korean? She want us to explain everything because she's not speaking English.
Oh, that's a great point.
Yes.
One of the things that we're going to do is we're going to translate this into the main COFA languages later on in the next week so that we can repost it in the main COFA languages so everybody can understand.
Korean, ba, kami minute translate di, kini yung ko tengan kayin majal, ilo, wikan etok, yung ko ni runga jagay. Olim malala ka ni rinit, ugodi. Come on.
All right, and then this one. Is that the same?
Yes, she
Okay.
want us to translate so she can really understand, and not only her but everyone.
Yes,
Come on.
absolutely. Yes. Okay, and then a question here. So this question says, is Apple Health only based on income? So maybe Ariel, you would have a better answer for this if it's only based on income.
That is one of the factors for seeing if you can get Apple Health. Income is one. You have to be a Washington state resident. You have to meet certain citizenship and immigration requirements for Apple Health through Washington Health Plan Finder. There are also typically age limits. For most people through Washington Health Plan Finder, it's programs for people that are under the age of 65. And then Washington Connection is through for people over the age of 65 with a disability, blindness, or in need of long-term services and supports. If you are applying for one of those programs, in addition to what I just mentioned, resources are also required. And those are kind of anything that can count as income, like a bank account, a burial plot. There's a big list there.
Awesome. Thank you. That is a really good question because I think people just think it's based on income, but there's some other factors that play into it. So that's good to know. Don't see any more questions in the chat, but if folks have any more questions, please go ahead and post them. But I actually have a question. So I know Auntie Gigi is still on the line. I'm wondering why insurance? Like what pushed you towards organizing to get insurance for folks?
Let's see. A lot of our community members, they come from the islands and they're sick. They're sick because of the, the atomic bomb and all that. And so there are so much health disparities. But when we, as an interpreter, was going through hospital visits and all that, they would either not be seen anymore because, they're back and forth trying to get insurance. One scenario is two brothers came from the islands, one of the islands that were destroyed, and the four atolls that they say that were contaminated. They came here to the States and they were sick, as community, as the people, they save their money to bring their families over to go to the doctors. And that time is, the income tax because it's a lump sum.
Mm.
And so they have to wait until their kids seek health, seek medical attention. But as they're waiting, they're not getting it. And so they finally get here to the States and still not getting it. So both of them end up passing away with all this debate on if they're qualified, what is their citizenship, all this kind of stuff that is, to me, is ridiculous to our people. And as they're trying to figure out, as I'm going to the appointments, they're not here because they were too sick to come over. But they're still trying to figure out, if they qualify for insurance and, all these little things that we don't have, especially preventative care for our people. Our people are proud people if they go once or maybe twice and ask to see if they're qualified for insurance, medical insurance, and they don't go anymore because, like I said, that we're proud people and we're not going to beg. We're not going to keep begging for your help. We'll figure out how to live, but we're not going to beg. And I saw that in a bunch of elderly people that were sick and didn't get the health care they needed. A lot of our folks don't get the preventative health, care. And so they just live with all our history of health. We just live and try to manage and try to live here in America and try to figure out how to do. And we don't go to the doctors, especially women. They don't go because one way or the other, they hear it from our community. Yeah, we were not qualified. Yeah, we're not. Yeah, I got a bill and I can't pay it, and now I got a bill or something, And that really, really affected me, because as a person that was, like I said, listening to all of this, it just broke my heart to see some of our people passing away without any kind of care when I don't know why, I don't know why is it a debate of why should, you get medical and all that. Okay, citizenship, but why are we allowed here in the United States? Why is that? And why can we come in the United States with just our passport? But when we try to apply for benefits, especially medical, then we got all these runaround about, this and that and this and that. We're not asking for free medical. We're just trying to get qualified to get some medical care, and I'm very passionate about it, trying to figure that out. And like I said, I'm grateful for where we are now, that we're in this kind of space that we can talk to HCA and, communicate more to understand, with everything that's happened. Thank, thank you.
Wow, thank you. Yeah, that's. I know it was such a battle and it took years to accomplish. So we're very thankful for all your work. It's looking like. Ariel, did you want to add something?
Yeah, I was just going to say, I think that's one of the great things about this partnership between HC and the PI Health Board, because we have a team on the line right now that can help people get health care. There, I think everybody on this line is a Washington Health Plan Finder navigator, and maybe Mia and team, you can. I guess my question to you is, what does that mean? What can you do for folks? How can you help them navigate that application?
That's a good question. I will pass that to the team. Like, Alinda, what do you think? Oh, you're on mute.
Do you mind if you repeat the question? Sorry.
Not a problem. So I think everybody here that I see Renza and Mia and Alinda, and Stella here, I can't see, are Washington Health Plan Finder navigators. So, what does that mean, and how can you help people? That Gigi described, the people that need health care, that need to apply and go to the doctor. How can you help them navigate that?
You mean how can I help them um, get their insurance, right?
Mm-hmm.
Mm-hmm.
Yes. There are so many ways you can do. You can call them. You can go to their home. You can do social media, and you can post like us. We're posting on social media, and the number there is 188-308-7113. And they also people like to call up. For example, for me, I've been able to get connected with lots of people on my phone from home. But I haven't. In December, I was going out to people's home, and there's a lot of people out there. So keep reaching out, keep sharing. So and also go to the community leader. There's this Seattle Marshall East Washington community. We can also like go to their leader, and they can share it with their members and share it with their families and members in their group and also other groups, and also go to the leaders. It's also the royalty leader, which they have lots of people, and yeah, that's how you're gonna get their, like get them to have their insurance, and especially help them. Like if you have the passion about people, and their health, if you're thinking about that, you need to go to them. Don't wait for them to come to you. So sharing, reaching out, and personally have that unique relationship with them, so they can be able to speak up and they can be able to communicate with you, and you can also like get them to apply for the what they need and what they want, and especially they can go to the doctor. You don't even just help them apply. You can go to them and make their appointment. You can educate them, especially educate them about the insurance, educate them about health, and going to the doctor, how important it is, so they can stay healthy and well. Thank you. More that.
Can I
Yeah,
add a comment to that?
of course.
Um, with like this PIP programs and different navigators of our COFA, I mean, now our people see us and they trust us, so that is very important. And to be able to be navigators on different languages and all that, I think it's a big step for us because after everything that has happened, there's a lot of trust issues with our communities. So, like, it was mentioned that you can trust us. We're here and we're in this space. Call us and do what you need to do. But there's that is happening now, and it's very appreciative.
Yeah, I actually that's exactly what I was gonna say. It's people that look like us that are doing this work and are able to help us, and people who will be able to sit with us and interpret the whatever comes in English, even because like your English might be perfect, but like I grew up speaking English and a lot of this was confusing to me. And so I can't imagine coming to this for the first time and seeing it, all the information and all the questions and trying to apply. But this is a team that spent a lot of time learning about insurance. They've gone through the system, so they understand it on that level as well. And it's just really inspiring to see them. And like this team especially has spent a lot of time in community doing a lot of COVID work even over the last couple of years. And so they built relationships, and that's important too, having those relationships. Brenza, did you want to add anything?
Just add on the same as Alinda, that yeah, like me reaching out to people and they see me on like this Facebook Live or see my post, then they start reaching out to me and thank for the PIHB and AC the health plan, because when they see stuff like this, they were like, "Oh, so you're the one helping with the insurance." So yeah, like I'm so grateful that I'm in this space with you all, helping out with my people in my community. Thank you.
That's great. Well, while we were chatting, we got a couple more questions. Hopefully, get them.
Can I chime in?
Yeah, absolutely.
I think what I appreciate most about this space is we have Gigi, who has been here since the beginning, right? Who knows the history of the COFA Islander programs, who advocated and lobbied and did such great community work that it shook Washington State, right? It shook them, and it produced a COFA. It produced a COFA Islander programs, and then again, Gigi and other advocates went out and advocated for this right here, having a vendor who will do the outreach and education. People, you said it, Mia. People will come to us because I mean, our COFA Islanders, they look like us, so they're gonna come. They want to come to people that they know. They know where what islands they're from. They know about the islands, the culture, the language, and I think this is huge, and it's very important that you all see that the work that you all are doing will benefit our community, and you are the advocates for them. I mean, it's huge having the Kofa Islander programs. It's even larger having advocates out in the community, an organization out in the community helping healthcare authority with the outreach. Right, this is exactly what we're working for, Gigi. And I'm so glad that you're here sharing. You shared the history and the continuous work that you all are doing, right? And I think someone I just saw that a comment said we have to be our own advocates. But I think as a community it's stronger that way, and this is what we see now. Ariel and I, we talk about this all the time, how amazing, we have the COFA Advisory Committee, how amazing, that we have islanders from the respective COFA islands, COFA nations represented, and that through their guidance and through, their work, we're able to do this. And this is the partnership that we are very fortunate to have and very excited to have, to work with you all. So this is huge, and I'm excited to see where we go from here, and to get guidance from Gigi. That's huge. Gigi, David, Rose, Rick. Oh gosh, there's so many that did so much work. And it's so great to see that their work really 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 paid off. So
Awesome. Yeah, I couldn't have said it better myself. All right, we got one more question here that came through. So the question is, how long is it going to take for a family who applies to receive their insurance card? I'm asking because I was applying last year in September and we haven't received ours except my daughter. So that depends. It usually takes no more than 2 weeks to get the provider one card that they talked about earlier, and then within the month for you to get your managed care plan card. So if you haven't received those cards yet, for the provider one card, if you haven't received that card, you would call 1-800-562 and let them know. If you haven't received your health plan card, you would have to call the managed care plan provider that you went through. Is that correct? Yeah, so you would call your managed care plan and check in with them to see where it could be, if there's any problems. But that is also something, like if you would need assistance, we would be glad to help you. You can give us a call at 888-308 7113, and we can go ahead and make that connection for you as well. All right. I think that's all the questions, and we're running out of time, so that works out. So just wrap up everything by going through some contacts. And I know Roz was saying earlier that their PowerPoint will be uploaded to our website, and I'll also upload this PowerPoint and all the contacts to both our website and to our Facebook page for folks to take a look at. So if you have any general questions, you can contact me. Everybody will have the same phone number, so that 888 number will be the same for everybody. And then if you want to reach the navigators, it's Renza at PI Health Board, Alinda at PI Health Board, Diela at PI Health Board, and Clara at PI Health Board. And then if you would need an interpreter in Costa Rican or Pohnpeian, you would call our toll-free line. There's the contacts there. And then we have a similar resource page going here. So there's additional resources that will be posted to our website along with any meeting notes and presentations. And that'll be on pihealthboard.org/COFA-Islander-outreach-information. And here's some links for where to apply for Washington Apple Health. So if you would like, you can go on whyhealthplanfinder.org. You can download their mobile app. That is our phone number if you would like assistance applying. They also have paper applications. And finally, if you want to work with the PIHB navigator, you can schedule that appointment through our website or give us a call. And then for individuals over age 65 and older, blind or disabled, can apply for medical assistance at washingtonconnection.org. And their phone number is 1-877-501-2233. Or so I believe that some DSHS offices are open for appointment, and you can apply in person there. So that is the end of my presentation. And I'll just, apparently, all right, there we go. I'll stop sharing and just take a moment and thank everybody for tuning in. And a special thank you to Ariel and Roz for giving us a presentation on Washington Apple Health. And a serious thank you to Auntie Gigi for getting on the line and sharing that history with us and keeping us accountable to the work that you built up. I think that's really important. And we're so glad that you're here to work with us and that you were here doing this work so this would all be possible. We're so thankful. And then in a couple weeks, we will be doing our What is Apple Health educational series on Facebook Live. So make sure to tune in and we'll be posting the flyers. But thank you for everybody tuning in. Have a great night.
Thank you. Thank you. Good job.
Thank you.
Thank you.
Come on, Aleph. Thank you, Gigi.
Come on.
Roz.